hello. How are you? Go ahead, type in the chat. Let me know how my mic sounds. I'm ready to rock and roll. I hope you are too. And we have a small class today, but I need you. I need you to talk to me in the chat. Ask your questions. I'll try and answer them in real time. Also, I have an amazing team here. I do. And I want to introduce them. I know I didn't even tell them. Usually I tell them, but I want to introduce them. I'm not going to ask you to take yourself off mute, Miss Eva. You don't have to because she's always in the back working. And I just want to introduce Miss Megan. So if you would just say hello, that will be amazing.
Hello, I'm Miss Megan. Nice to meet you.
Yeah, she helps me out a lot. Thank you, Miss Megan. And Miss Ida. How are you, Miss Ida?
Hello, how are you, coders?
Awesome, awesome. Miss Ida's amazing too. She was an excellent intern in advanced IMTAP. And Miss Eva, if you're available, please take yourself off mute. If you're not, I know you're busy. All right. Okay, so hello, hello, hello. Please, coders, talk to me in the chat. How does my mic sound? All right. Thank you. Thank you, thank you, thank you. All right, let's get started. All right, so last time we reviewed domains 1 and 2. This week, we're going to review domains 3 and 4. So let's get started. And we're going to go ahead and just remind you what's on the exam. And of course, we have 5 domains. The required texts for the exam are as follow. If you intend to test after May May 1st to April 30th, 2025, you will need 2024 manuals. You'll need your ICD-10-CM. Okay, my HCPCS is there. Okay. You'll need your ICD-10-CM. You'll need your HCPCS Level 2 and your CPT, all 2024. AHIMA is extremely strict about the publisher and the year, and we have placed the list, the official AHIMA book list, in your LMS. So definitely reference it. Additionally, for this class, you will need principles of healthcare reimbursement and revenue cycle management, as well as certified coding specialist, physician-based CCS-P exam prep. 13th edition will do just fine. All right, I do have a disclaimer. This is an advanced professional coding CCS-P class, and you must know the following. You must already know ICD-10-CM guidelines and CPT guidelines, or where they are, right? Particularly, more important, where they are. So if you've skimmed through your instruction, you may have to go back and refocus on those guidelines. All right. The MCG is highly recommended. So for the exam, but tonight we're going to focus on domains 3 and 4. Specifically in domain 3, the tasks are to differentiate and apply physician-based coding rules based on federal, state, and third-party guidelines. Also, you'll need to determine the appropriate authoritative or governing source to facilitate correct coding. And finally, recognize the use of natural language processing in data analysis. In other words, recognize artificial intelligence, machine learning, computer assisted coding, etc. Or we're going to just really have a discussion on AI in medical billing and coding. But I do have a disclaimer, and I will be repeating it throughout. The disclaimer is You must be familiar with this information. You do not have to have mastered it. No, familiar. I will show you the exam-like questions, and hopefully that will give you some understanding of what the learning level should be. And it is not mastery, but you need to know what it is. That is the goal today. And we're going to start with task number 1, differentiate and apply physician-based coding rules based on federal, state, and third-party guidelines. Well, we'll begin by saying, who establishes the medical coding guidelines for outpatient and professional coding? Who are these people? Well, we'll begin with Center for Medicare and Medicaid Services, CMS. They develop the guidelines for Medicare and Medicaid coding and billing, including HCPCS Level 2 and PCS. They develop HCPCS and PCS coding code sets. They also establish the guidelines for the NCCI edits and a few other things that we'll talk about. But most importantly, they develop HCPCS and PCS coding. Number 2, or the next option, is American Medical Association. We know they're responsible for the development of CPT codes, right? So nothing more needs to be said until later. Also, WHO, World Health Organization, they develop ICD system, ICD-10, but they develop it for the world. It's developed or offered as a global standard for diagnosis coding. Next, National Center for Health Statistics, or NCHS. They collaborate with the CDC and they create ICD-10-CM. That's the clinical modification that is developed for the United States. And next, American Hospital Association. Now, they don't develop a code set like CMS, like AMA, like WHO, or NCHS, but they do develop the AHA Coding Clinic. That is a tremendous, well, it's a wealth of information. It's a publication that offers guidance on how to code ICD-10-CM and PCS. So it's a heavy hitter, and they are responsible for guideline development. Also, the 4 cooperative parties. In fact, the 4 cooperative parties work with American Hospital Association, or AHA, to maintain ICD-10-CM and PCS. So they help maintain it. And who are these 4 cooperative parties? CMS, National Center for Health Statistics, American Hospital Association, and can anyone tell me what the last one is? Go ahead, if you can, tell me. Anybody, team, if you know too. Look at that, look at that. Close. The last one is AHIMA. And remember, this is ICD-10 and PCS. So AHIMA is a big player in this guideline industry. All right. And finally, third-party insurance carriers. They establish their own specific coding guidelines and documentation requirements for reimbursement. So these are the players who develop guidelines for outpatient and professional coding. And if you want to see it again, it's the American Hospital Association ICD-10-CM Coding Clinic. They help, coding for ICD-10-CM and PCS. All right, so it's a publication. Also, AMA, we know they have the CPT. CMS develops PCS and HCPCS, and they also work on these NCCI edits. We'll talk about that a little later. Then you have the NCHS with the CDC. They create ICD-10-CM. Also, you have your third-party insurance companies. World Health Organization develops ICD for the world, and you have your 4 cooperating parties who help AHA, and they create guidance and help to maintain ICD-10-CM and PCS. So let's go ahead and see what you know. Oh, Mrs. J, what are you doing? Well, this is how you learn. I'm going to come back through and have another discussion more in depth to help you just really know what they do. All right. Question number 1. Which entity publishes the ICD-10-CM coding guidelines used for diagnosis coding in the United States? Who does it? Yes, 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 yes. And you know what I was told? I was told that, hey, you're giving them too much time. And that's right, you guys were rocking last time. I'm going to be more mindful. And if you said C, outstanding. National Center for Health Statistics, that's a division within the CDC. And CDC also works with them to develop ICD-10-CM. Okay. Who is responsible for the development and maintenance of CPT codes? Mm, that's right. Okay, okay. Indeed, indeed. And the answer is AMA, American Medical Association. Outstanding. All right. The Healthcare Common Procedure Coding System, or HCPCS, Level 2 codes are maintained by which entity? They are developed and maintained by this entity. HCPCS Level 2 codes are maintained by CMS. Yes, they create these codes every year, every year. All right. Which entity provides official coding guidelines and advice for the ICD-10-CM through its coding clinic? Who has the coding clinic? All right. If you said A, outstanding, the American Hospital Association. All right. National Correct Coding Initiative, or NCCI edits are designed to prevent improper coding and billing practices. And it's overseen by who? Who oversees the NCCI edits? If you said CMS, way to go. All right. The International Classification of Disease, or ICD system, used globally for mortality and morbidity statistics, is created by, all right, you all rocking that. Oh, let's go back. Sorry about that. You all said who? Outstanding. All right, who establishes some of the coding guidelines that third-party payers, including private health insurance companies, must follow for reimbursement? A, Blue Cross Blue Shield United Health Group. B, Center for Medicare and Medicaid Services. C, American Medical Association. Or D, World Health Organization. The answer is A, Blue Cross Blue Shield United. These are two third party. These are two of the several third party health insurance companies or third party payers. All right. And they create their own guidelines. But I'm telling you, they do follow what CMS does a lot. All right. Evaluation and management services coding guidelines used for billing physicians services have been significantly influenced by A, AMA, B, CMS, B, CMS, C, WHO, or D, NCHS. Okay, yes, you all got it. It's AMA. No one fooled you. All right, I think we got one more. Now, this is a one that you probably should know, but this is just for the, oh, no, 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 not this one, the next one. All right. The entity responsible for adapting this ICD-10 for use in the United States healthcare system, including clinical modifications or ICD-10-CM, is A, AMA, B, WHO, C, CMS, or D, NCHS. What say you? All right, you all got it. See, outstanding. Yes, National Center for Health Statistics. And finally, this one is just for the purpose of education. All right. Which of the following entities plays a key role in accrediting health care organizations and indirectly influences medical coding practices through its standards? A, the Joint Commission, B, CMS, C, AHA, or D, AMA? That's right. That's right. You all know how to take a test. That's right. So if you said A, the Joint Commission, it is indeed. And they are not significant when it comes to outpatient coding because they typically work with hospitals and accrediting hospitals. So I just thought I would tell you that, but when you move to CCS, you'll need to know that. All right. All right, so now we're going to move to the second task within Domain 3. We're going to determine the appropriate authoritative or governing source to facilitate correct coding. So we're going to do more on these agencies. We're going to kind of learn more about them and what they do and how they impact coding. So we know that the World Health Organization, or WHO, they developed ICD, not ICD-10. How did that get there? I'm so accustomed to saying ICD-10. Oh, no, 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 they did. They did. I'm sorry. They developed ICD and ICD-10, but they developed ICD, right? And they're located in Geneva, Switzerland. And they even developed ICD-10. They've developed 11, and they will develop 12, 13, 14. They develop the ICDs. This is a global collaboration of member countries. So different countries all together, they collaborate on this initiative. And the purpose of ICD, I'm not going to say 10. The purpose of ICD, let's go back, is to standardize and categorize diseases and health conditions globally. You know, there's a world outside the US, right? So we all have to follow the same standard. They also, these ICD codes are also purposed for epidemiological research, healthcare management, and allocation of resources on a global scale. And just so you know, clinical modifications, or CM, is the US's version of ICD-10, and we call it ICD-10-CM. So with the establishment of ICD-10, or with the establishment of ICD, the World Health Organization also establishes the guidelines surrounding those codes. Now let's move on to the AMA. We know the AMA, the American Medical Association, and they publish and maintain CPT codes and guidelines. So current procedural terminology, or CPT, is a comprehensive, standardized code set to describe medical, surgical, diagnostic services and procedures. And these are developed and maintained by the AMA. And the purpose of this code set is to facilitate a uniform communication among healthcare patients, payers, and oversight agencies about medical services and procedures. So this is, and in this capacity, AMA develops the guidelines for CPT. So what are the guidelines? Well, we have general, these are just some examples of guidelines, right? You've got general surgical guidelines. You have general system or section guidelines. In most publications, the pages are green, but if you have an e-copy, it's white. But these are your general system or section guidelines that pertain to all of the codes within that particular section. Also, you have specific system or section guidelines, and these are the guidelines under the blue bold headings. Also, you've got parenthetical guidelines, right? And these parenthetical guidelines are the guidelines that exist within parentheses. Oh, let's go back. So if you see this do not within the guideline, that's your parenthetical guideline. And did you know that the publications by AMA, CPT changes, and the CPT assistant, and you'll see it right here where you see that blue arrow and that green arrow. These are publications that have guidelines and updates or clarifications to these CPT codes. And these are all published by AMA. Next, ICD-10-CM, the National Center for Health Statistics, NCHS. Again, it's a division within the Center for Disease Control, or CDC. They develop ICD-10-CM, the clinical modifications for the United States. And remember, the WHO develops ICD-10 or ICD, and then NCHS is responsible for those clinical modifications. The purpose is providing a detailed classification system for diagnoses and health conditions to support healthcare billing, reimbursement, and administrative functions in the U.S. Now, let's move on to the AHA. Now, this is the only one of the crew who is not responsible for a code set, developing a code set, but they do produce a quarterly newsletter called the Coding Clinic, the American Hospital Association Coding Clinic, and it provides official guidance, guidelines. Anytime you see guidance, that means guidelines and coding advice and clarifications for ICD-10-CM and PCS code sets. So it's very, very important in terms of clarifying or providing advice on those code sets. And this coding clinic newsletter is developed by AHA in partnership with the 4 cooperating parties: AHIMA, CMS, NCHS, somebody's missing, oh, AHA. So those 4 are the cooperating parties. And the purpose is to offer authoritative guidance to ensure accuracy and consistency in the application of ICD-10-CM and PCS codes. So if you want to know how to code a particular ICD-10-CM or PCS code, this is where you go. In fact, if you go to the AHA AHA website, there are some pretty key things you can obtain right from the front page, you can purchase the Coding Clinic subscription. So as they come out quarterly, you will see them if you subscribe. Also, you can purchase the Coding Handbook. That's the Nellie Chison Handbook. That is by far the best publication for ICD-10-CM and PCS by far. So if you want to really develop your skills, I highly recommend the book. Also, you can get continuing educations, and there are resources for educators right here. But one thing that I really like is if you have a particular question that's not addressed in the coding clinic, you can just submit a question. Boom. And they do have guidelines. They say, hey, make sure you've, checked out the coding clinic first and make sure that it hasn't already been asked. And submit your question. I think that's amazing. All right, so just want to remind you that if you're interested in getting the Coding Handbook by Nellie Leon Chison, this is this is phenomenal. The best publication or practice guides for ICD-10, PCS, and CM coding. And finally, so I made a mistake when I said AHA is the only one on the list who does not create a code set. Also, third-party insurance companies. How do they make guidelines? How do they establish guidelines? Well, what are they? They are health insurance companies that provide health care coverage for risks, and they call risks illnesses, injuries, diseases, and preventions. Companies like United Health, Blue Cross Blue Shield, Kaiser Permanente, these are all third-party insurance companies. Now, just so you know, a health insurance policy, they document specific coding guidelines, and I'm going to show you in a minute. And if you want to know why health insurance companies are called third-party insurance companies, here's why. Because in health insurance, the insured is the first party, the provider is the second party, and the insurance company considers themselves the third party. So that's why it's called third party insurance. So, how do they create guidelines? Well, their health plans are riddled with guidelines. Let's take a look at this health plan summary of benefits, right? So the deductible is not a coding guideline, or the out-of-pocket maximum is not. Now these, when you get to the physician services right here, and then you look down, you see telemedicine, and it says not covered. That is a form of guidance. Preventive care, if it's out of network, it's not covered. It's just not covered if it's out of network. Telemedicine is not covered if it's out of network. Your diagnostic labs, not covered if out of network. But also, they have billing guidance here, but in terms of coding, if it's not covered, diagnostic labs is 50% after deductible. So these are billing guidelines, but anything that's not covered, that is a guideline. That's a form of a guideline that coders and billers have to follow. So third-party health insurance carriers, indeed, they create guidelines for medical coding. Now, let's talk about the big kahuna. The big kahuna is CMS, Center for Medicare and Medicaid Services. They developed the following code sets: PCS coding and HCPCS Level 2. But here's some here's some information about CMS. Well, Center for Medicare and Medicaid Service, this is a federal agency within the U.S. Department of Health and Human Services, and they administer the nation's most major healthcare programs: Medicare, Medicaid, CHIP, and the healthcare marketplace. So they are one of the largest insurers in the United States. And CMS has they very heavy influence on guidelines on all major code sets, including CPT. And I'm going to show you in a moment. Now, CMS is directly responsible for PCS coding. And if you didn't know, PCS is inpatient or facility procedures, right? Not procedures carried out by doctors, but procedures that facilities provide resources for. So if somebody has a hysterectomy, the facility has to provide an operating room, staff, um, discardment of the body part, etc. All those little ancillary charges that you don't really think about, those have to be coded for, and we use PCS codes to code for those resources. Now, HCPCS level 2 codes, we know what those are because at this juncture we've already studied it, but CMS is responsible for developing them. Now, CMS works as a cooperative party with AHA to develop the coding clinic. And coding clinic, they are pretty much the authority in terms of developing not the guidelines, but clarifying those guidelines, augmenting the guidelines, adding to the guidelines. So once it's already developed, you need an authority, and the AHA, in concert with the 4 cooperating parties, that's who does it. All right, so you've got CMS, they create DRG assignments. They create MCDs, NCDs. And what is MCDs and max and coverage determinations? I'll tell you in a moment. And they develop NCCI edits. And this says if a procedure can be coded together. Procedure? CMS is in the business of diagnosis codes, right? But no, this is where they work with AMA. And they say, hey, these procedures can be coded together, and they produce a publication called the NCCI Edits. It's not a publication per se, but they have a database. Okay. All right. So I gave you a lot of information. So let's summarize some things. All right. So they work with, I think my things are out of order. Let me pull this up a little bit. All right. All right. So for ICD-10-CM, they work with AHA in development of the coding clinic, and this is how to code specific diagnoses and PCS codes. Also, this MCD, NCD, and MAX, LCDs too, but these are Medicare coverage determinations. This says, hey, is it medically necessary? If you want to know if something is medically necessary, you'll consult the MCD. These NCCI edits, pretty much, it tells if procedures can be coded at the same time. Now, why do we even need these NCCI edits? We kind of know if procedures can be coded together. Well, in a general sense, we do. We can look at separate procedure. We can deduce if something is integral, etc. But NCCI edits tells you definitively if they can be coded together. So for for ICD-10-CM, they work with a coding clinic. Now the DRGs here, this is for facility coding, so I don't want to really get into that, and it's not applicable to this exam. Your MCDs, NCDs, and MACs, these are coverage determinations, and this tells you if it's medically necessary. A lot of times we just guess. We say, okay, the procedure and the diagnosis match, so it's medically necessary. If you really want to know if it's medically necessary, there is where you do it. And if you were in part 1, you saw me do a demonstration of the MCDs, NCDs, and LCDs. And if you haven't, you can watch the playback because it is in your LMS, the part 4 in this CCS-P LMS. And finally, this is one thing I want to tell you about CMS, and we've said it earlier, but I want to emphasize it. Now, I didn't say it today, but earlier in your instruction, you've learned that Medicare patients, CMS mandates that Medicare patients must use HCPCS Level 2 codes instead of CPT codes when they are available. When you take your medical coding exams, you're going to need to remember that. We'll have some exercises that may test it and help you remember it. All right, so I know it's a lot to learn for CMS, but I did create a chart that should kind of clarify what you need to know. But you know, it's not that much. And remember, you just have to be familiar, not mastery. Now, at this juncture, I want to talk to you about CMS and NCCI edits. So NCCI edits, what is it? Well, CMS created the NCCI edits. It's called National Correct Coding Initiatives. And within that initiative, they created these edits that works to promote correct coding and reduce improper coding with the overall goal of reducing improper payments of Medicare Part B and Medicaid claims. So pretty much CMS just really wants correct coding, so they created this initiative. And if you go to the CMS.gov website, you can read up more about it. It's cms.gov and just search NCCI edits. Now let's get to the good stuff. All right, so how does NCCI edits work? Well, first, you need to know that these edits apply to the same beneficiary. And when we say beneficiary, Medicare is talking about their insured on the same date of service and same provider in the outpatient. In other words, this applies to procedures, more than one procedure carried out on the same day by the same patient and the same doctor. I think I said that backwards, but you know what I mean. This applies if a patient has more than one procedure, right? And we call these procedure to procedure edits or P2P edits or pair to pair edits. So this tells us when two codes can be coded together. And it looks like this. You have column 1. In the first column, you have a code, and the second column, you have codes. So this procedure to procedure edit lets you know if column 1 codes can be coded with column 2. All right, that's it. So if you want to know if 99215 can be coded with G0101, you just look at your indicator, and if your indicator is correct, then it will substantiate. If if your indicator is appropriate, then it will tell you if you can code them together. So here are the definitions. If it's a 0, it's not allowed, never. If it's a 1, it's allowed. And if it's 9, it's not applicable. All right. So you don't do anything when it's not applicable. All right. So what are you talking about, Mrs. J? Let me show you another board. Let me make it bigger. You've got your column 1 and you have your column 2. So we want to know, can 10060 and 10061 be coded together? And if you look at your indicator, it says 0. So that means never. You can never code these together. And then there's no possible modifier that you can use. 10120, 10121, it has an indicator of 1. So that means you can code them together, but if you do, it's going to need a modifier. And here are the possible modifiers that you can use. Now, 11010 and 11011, this is not applicable. It's something that you won't do because it's not applicable. These could be 2 add-on codes, etc. All right. So 0 means never. 1 means you need a modifier if you can code it. And that's it, coders. So this makes our lives easier. It'd be nice if we can take this to the medical coding exams, right? So let's go ahead and practice. All right. It is straightforward. It is. It's not difficult. All right. So this is your turn. I know I've been talking a lot, but here you go. NCCI modifiers associated with NCCI edits are allowed with the P2P code pair and the review of the rationale when the indicator is A, 0, B, 9, C, 3, or D, 1. What say you? Okay, outstanding. So the key word is allowed. And if we go back to our little chart, if it's a 1, it's allowed. So the answer is D. Way to go. Way to go. All right. You are billing an NCCI code pair. You've just reviewed the NCCI edit table, and the code pair has a 9 indicator. Can you append modifier 59 to it? Yay or nay? Outstanding, outstanding, outstanding. Absolutely not, right? It's not applicable, right? So you just can't code them, right? They could be 2 add-on codes. We would never do that, right? All right, good job. All right, so here's our final question. The way to resolve NCCI pair-to-pair code edit number 1 is the use of appropriate CPT or HCPCS modifiers. Oh, this isn't a, I'm sorry. I'm summarizing. Please forgive me. So the way to resolve the NCCI pair-to-pair code edit number 1 is the use of the appropriate CPT modifiers. The clinical documentation must support usage of those modifiers. Now your pair-to-pair indicators, don't forget, 0 is not allowed, 1 is allowed, and 9 is not applicable. You all did a fantastic job. Now it's time to test your knowledge, okay? All right, so this was just kind of like a summary. Now, this is probably like what you'll see on the exam. Now, these questions pertain to domain 3, and let's do it. You all ready? Okay. The answer is A, 96372, B, J0558, C, 96374, D, 96372, J0561. When a Medicare patient receives an intramuscular injection of penicillin G benzathine, 100,000 units only, what is the appropriate code assignment? All right, coders. I didn't even put a time clock here because you all were so fast. The last time. Okay. Good job. All right. So most of you got it correct. And you know what? This is going to be an aha moment for some people. Hey, whenever you are coding for injections, you need a push and product. Always. You code for the administration and the medication, right? All right. So, A, oh, wait a minute. We got a guideline here. What is the guideline that we have to follow? There's only one that I really want you to know. Go ahead. Does anyone know? Type it in the chat. Okay. Well, the guideline is when a Medicare patient receives an IM injection, when a Medicare patient receives anything, if there is a applicable HCPCS level 2 code, you're going to have to use it. But this is not our case. It's not our case. If there was an injection code, you know, a HCPCS level 2 injection code, that'd be different, but there is not in our case. All right, so A is incorrect because it's only coding for the therapeutic prophylactic or diagnostic injection, subcutaneous or intramuscular, while the injection, that administration, is correct. It's missing the HCPCS level 2 code, so A is wrong. B, oh, so let me go down to C and tell you why C is wrong, because it's coding for an intravenous push. That is the route. It's not intramuscular injection. So B is incorrect. C is incorrect. Oh, excuse me, C is incorrect. Sorry. Now B is incorrect because it's coding for the wrong medication. It's coding for injection of penicillin G benzathine and penicillin G procaine. That penicillin G procaine is not mentioned in our documentation. So B is incorrect, and the answer is D. All right. All right, let's go to the next one. Now let's.
Thanks for tuning in, and until next time, happy coding!